Welcome to This Week in Hearing. Hello, I'm Bob Traynor, your host for this episode, which brings to us a one of the CAPD gurus in our profession, Dr. Frank Musiek. Dr. Musiek is here to talk to us about a symposium that's coming up here very soon called The Quest for the Best in CAPD and Neuroaudiology. This is a symposium that's going to discuss the clinical journey through CAPD from the past, present, and into the future. Thanks for being with us today, Frank, and we appreciate you discussing this important meeting with us.
Well, Bob, I'm so happy to be here, and I'm grateful for the invitation to come and talk about this exciting symposium that we're going to do that is going to, I think, highlight some of the real advances that we have learned and maybe haven't learned or forgotten over the years. So I'm really excited about this, and we plan a really good program for people to attend.
And understand this is the third year for this symposium as well.
It's the 3rd year. We've had, 2 years of highly successful programs, having to deal with CAPD and neuroaudiology, and, this one with a great faculty that we have, we're looking forward to having another, good year for this and imparting some good information. This year, it's a little bit different slant. We have some very interesting topics, and in previous symposiums, we've been excited because we've had a lot of people turn out for that, and I hope we'll get a lot this year too. But we are looking at the idea of highlighting the particular advances in CAPD that have accumulated over the years, going back to 1954 and Ettore Bocca's, contribution to central auditory testing. Because as we've looked over the history of CAPD, and our faculty, which I'll mention in a minute, have been involved in it for many, many years, we came to the conclusion that one of the best things we could do is actually highlight some of the things that people have either forgotten about or perhaps never learned over the years that have been key ingredients to doing appropriate CAPD and neuroaudiology assessment and management. And so we've kind of used that theme this year to kind of cover the main topics that we think are critical for people that are doing CAPD to make sure that they understand these basic principles that have accumulated over the years. And so we've broken it into four parts that covers about 4 hours. Um, and the first part will be dealing with the assessment over the years that have accumulated in terms of the particular test procedures and the interpretation of these test procedures, as well as their underlying principles. And then the second major part is the electrophysiology in terms of assessing CAPD and the role that that has played over the years, especially in neuroaudiology. And then also, we are going to talk about um, the management, the rehabilitation of CAPD problems, and we'll devote a major segment to that particular area. And
Well,
then we're
Frank,
going
this has always been a combination kind of the research and the various issues going on in CAPD, but also with a lot of clinical application for those of us that gotta hang out in the clinic a little more than we hang out in the laboratory.
Mhm. That's true, and we've always had that as an underlying theme, and over the years, the basic science has blended well, and we are going to touch on that. In fact, I'm glad you brought that up, Bob, because there's an important point to be made there, and that is doing the test is one thing, but the ability to interpret it appropriately really leaves some of the clinical, and you have to delve into some of the basic science the physiology, the neurology that underlies it in order to make the appropriate types of interpretations. And that's something that we're going to link up with and kind of emphasize in this particular symposium, because our feeling is that that has been a little bit, shall we say, it's been shunned a little bit or maybe misunderstood over the years. But we also are going to spend a last segment on a very popular part of the program for the last couple of years, and that is the case studies. We're going to have the case studies. Now, our particular faculty is Jen Shin is the co-director with me. She's at the University of Kentucky, and she will be conducting that case study segment. I will be doing the assessment, behavioral assessment. Jay Hall will be talking about the electrophysiology. And Bill Keith from Down Under actually will be talking about the management and rehabilitation in terms of CAPD. So that's kind of our main uh, group of people, all of which have extensive, shall I say, experience, maybe more than we want to mention, Bob. But we all have been doing this for many, many years, and I do think we have a perspective that is going to be very important to bring out, and I think people will really appreciate it because I think it will hit home on some things that we've either forgotten or never learned about CAPD over the years.
So, um, so the workshop, not a workshop, it's a symposium now, and that's going to be on March 28th. And I think that it will be offered at 12 o'clock Eastern Time, 11 o'clock Central Time, 10 o'clock Mountain Time, and 9 o'clock Pacific Time. And any particular specifics about costs and how they can get involved in the symposium itself?
Well, we have, the cost has always been it's virtual. It's important to mention that as a
Oh yeah, that helps.
the broadcast, and I believe, for professionals, it's $45, and for students, it's only $15, and if I could, put a pitch in, Bob, for, um, the students, I know often in the last couple of years that we've done this, that, we've had great turnouts, but we've been a little light on the students, and I think sometimes they feel that, this is more for professionals in the field. Well, we really and truly have tried to orient it not only for the professionals in the field, but also for students. And we would really encourage the students to turn out and learn about this particular topic, which kind of brings me to another point, Bob, if I could make it, and that is, CAPD is complex. It's not a simple discipline that you can learn readily. And therefore, these kinds of educational programs are critical, not just for the professionals, but also for the students. And despite the fact that, yes, I know students most of them get a course in CAPD in their AUD curriculum, it really, despite how good the course may be, it really is not enough to make yourself, how shall we say, adroit at doing CAPD or neuroaudiology. And therefore, we really are doing these symposiums not for just the professionals, some of which have had a lot of experience, but also for the more junior people and for the students, because we think it'll supplement what they have learned in a very critical way because of the fact that this is a tough topic, an interesting one by all means, but a tough topic to grab onto and learn about. So we really encourage not just the professionals, but also the students to tune in and listen to this particular symposium that is going to go over the major advances over the years, what we've learned, what we've forgotten, or maybe what we didn't learn. Um, and I think they will find that very worthwhile.
As a person who spent a lot of time in the clinic, I think and I didn't get into CAPD in too much depth, but I'm always as a clinician, even if you're not considering conducting CAPD assessments in your clinic, you know, a lot if you don't do it, you need to know when to refer and how to refer and who to send them to and the kinds of things that have maybe as will be presented in the symposium, what happened in the past, what happened now, and what's going on to possibly in the future, so you can make intelligent referrals to colleagues that spend a lot of time, energy, and effort working into this component of the profession.
Yeah, that's a great point, Bob. And in fact, I want to elaborate on that maybe a little bit more. In this particular symposium, we're going to see some of that because in the last segment of it, which I think we're devoting like an hour and 10 minutes to it, it's a major section, is Jen Shin is going to be conducting these case studies. And like last year, it was very popular, as I mentioned, but last year she pulled out some really difficult cases. And within those cases, if you look at them, you will see how the referral pattern actually evolved, which is important because sometimes what happens is, well, it happens more than we like to have it happen. But what happens is a patient will come in, and it could be a child or an adult, and the patient has a normal audiogram, normal pure tone audiogram, excellent speech recognition ability. But the patient complains that they have trouble hearing, or they have trouble understanding, they have trouble hearing a noise, they have trouble following things. And yet, as we've researched, we found that most of these people in the audiology community today are turned out the door without any further referral. And this is not good. And this is something that we've really got to work on as an audiology group in general, is that, as Carhart once said, if the audiogram does not fit the symptoms or the complaints of the patient, you have to look further. And those words came back in 1959 from Ray Carhart, and they couldn't be more true today. We cannot let these people go who still complain that they have trouble hearing because we are the audiologists. That's what we deal with. And if we can't or don't do the evaluations that perhaps go beyond the pure tone audiogram and basic audiological evaluations, we need to make the right referral to make sure that these people get service.
Frank, and this is just a question from a clinical guy, but uh, would would a screening test for a referral to a person that does specialize or has quite a clinical expertise in CAPD, would it be doing something like high frequency audiometry? And if that's kind of normal, then that probably there's some issues going on there, or maybe that wasn't the right assessment. But it seems reasonable that if you have some hearing loss up there, then that tells you one thing, but or it may not tell you enough, and we need to do something with that.
Yeah, and I think, I mean, high frequency audiometry is one of those possibilities that you can go to when you have these situations. But I think the literature shows pretty well that most of the time when these people have these complaints, and not most, I mean, overwhelming, they end up having a central auditory deficit of some sort. And it can be other things, but highly unlikely. It appears pretty clear that most of the time when people come in with good audiograms and say, I'm having real trouble understanding, especially in noise or difficult listening situations, the alternative, the most optimum one to go to is probably looking further upstream in terms of what the problem may be.
It just seemed like that would be a simple thing some people are doing, and, "Oh, gee, I found it." Well, maybe they didn't quite exactly find it. There may be some other things going on there.
Yeah, that's very true, and that was a good point.
Well, these are the kinds of things that you'll find out at the symposium that's gonna be March 28th. It's gonna be a very reasonable cost virtual symposium for students, audiologists that refer for CAPD assessments, as well as for those of you that are specialized in this area. And, so I really wanna thank, Dr. Musiek for being with us today to tell us
And
all
Bob,
about.
one thing before we leave, I just wanna make sure that people know the contact. I think we talked about that earlier. It's
Yeah,
the
and I put that in the chat, and so the contact for the symposium, in case you haven't heard anything about it or wanna know more information, is the name Jennifer dot Shin at uky.edu.
Mhm.
And, and and my guest today has been, Dr. Frank Musiek, who is the editor of Pathways for Hearing Health and Technology Matters, as well as has coordinated a sponsorship with, Dr. Shin at the University of Kentucky Department of Otolaryngology. Thanks again for being with us, Frank, and we'll talk about this another day, another time.
Thanks so much, Bob. I appreciate it, and take care.